I think one of the things that they'll first notice when they get here is that they're treated with kindness and care. You have a group of people who not only understand addiction from the textbooks and understand the literature and the science behind it, but they also understand it personally. It's affected their lives in some way. And I think it makes us uniquely qualified to give a certain extra special care to those patients that come in here because we understand personally.
Initially, for that first 3 to 5 weeks, they struggle a little bit because they've been told for years that they have these psychiatric diagnoses. And so it's our job to kind of help them to work through that, and we challenge that with them, and we give them alternate coping mechanisms to drugs. What I've found after a few months, several months, is that they're usually quite happy with being chemically free, that they are not chained to a doctor, to a diagnosis anymore, to any kind of medications anymore, and they can go and they can live their lives in society. They've been told for many years that they have all these different things wrong with them and that this medication is needed or this medication is needed. And then they come into our facility and we say, well, let's just treat your alcoholism and your addiction and let's see what happens. And so what they find is that they're a lot happier because they're not chained to go into the doctors and getting the medications and taking this rigorous routine of medicines every day.
The detoxification process is highly individualized per patient based upon a number of different factors. One is drugs of choice. 2 is their medical history, and 3 is even their age group, or maybe if they've suffered head trauma. What I do is I try to get them in a risk group category because there are some types of withdrawal that can be potentially lethal. And so my primary concern is making sure that they're safe. My secondary concern is to make sure they're comfortable. And so, preserving that dignity and the comfort is obviously a very prime concern along with the safety.
Most patients, what we have found is they actually do not have psychiatric diagnoses, and their problem is alcoholism and addiction rather than a myriad of psychiatric diagnoses. However, we do have some that actually, through a period of evaluation over several months, a continual evaluation from the clinical director, the doctor, the treatment team, we have found that there are a few that do have psychiatric diagnoses, and we treat those appropriately.
How do you identify that they have a real a psychiatric diagnosis, and then how do you treat them?
What we do is we evaluate the patient constantly. So they're being evaluated on a daily basis while they're in our detox unit as well as on unit 2. And once they enter an extended treatment, they're being evaluated probably weekly. So they're being evaluated by counseling staff, by doctors, by the clinical director, by rec therapy, by the nursing department. And throughout this evaluation process, we're able to determine if they truly have a mental diagnosis that differs from alcoholism and addiction. And if they do, and if it is determined that they do, the doctor may prescribe appropriate medications to treat it. The counselors may employ some different psychotherapeutic tools that they can use to treat the mental disorder in conjunction with the alcoholism and the addiction. A psychiatric diagnosis that they have before they enter our facility, a real common one, is bipolar disorder. We have a pretty high incidence of personality disorders that they're diagnosed with, and another pretty common one is major depressive disorder, the whole myriad of anxiety disorders. When they come in, if you're drinking alcohol, you're going to be depressed and you're going to get diagnosed with depression. If you are doing cocaine, you're going to be nervous and you're going to get diagnosed with some kind of anxiety disorder. But when you remove all of that from the patient when they come in, what we find is when you treat their alcoholism and addiction, that you don't have the depression anymore, you don't have the anxiety anymore. You may have some nervousness and some stress, but we teach them coping skills that do not involve medication to treat those.
Our detox philosophy revolves around trying to find a patient's true baseline. We want to find out what is addiction, what is mental health, what is behavioral, what is not. And the only way to really do that is to get somebody totally and chemical free, and we do that through a detoxification process that I've described earlier. With that said, what I want to see is whether or not they are truly bipolar or schizophrenic or anxiety or depression. The only way to know that is to see their brain chemical free. So we try to provide that environment here, get a person to baseline and see exactly what we have, and then treat it appropriately.